But I loved it. That was so well. We want to know you, Deepti, first.
Yes.
Many people call her Dr. Talluri. So, Deepti, on Express with Sirisha, we like to keep it raw and real.
My profession is my passion, and my passion is my purpose. Drug addictions are also happening in the teenagers, compared to adults, schools, especially in countries like America and all.
Self-awareness, noticing the patterns, being present,
Yeah.
seeing your changes, noticing your changes.
I don't know, somehow I can feel and sense the energy, that vibration and all. I think I can sense it. I know everything,
Close my eyes now. So I'm secretly in my head, I'm thinking. We often ask ourselves questions like, why doesn't my child understand me? And probably the kid is thinking, I thought I said the right thing. Why are my parents overreacting? Sometimes I think, what is the purpose of my life? Am I doing what I need to? What am I doing? Why can't I stop overthinking? Is it just me, or does everyone go through this? These are the random questions that come to our mind, you think? But the truth is, these aren't random thoughts. They are reflections of battles we fight in our minds every single day. And while medicine heals the body, a very few dedicate their life to healing minds and souls. Welcome to another episode of Express with Sirisha. And today I am beyond honored to sit across one such person. She began her medical journey in India, moved to the US, and rebuilt her career from the ground up, studied again, and chose to dedicate her life to the most powerful yet sensitive field of mental health. She specializes in cognitive behavioral therapy. Now, for those who are new to this term, let me tell you what this is, the little I understand from her when I spoke to her. It is a type of talk therapy that connects the dots between our thoughts, our feelings, and our actions. The idea is simple. Our thoughts shape how we feel, our feelings influence how we act. And by learning to recognize unhelpful patterns and reframing them, we can actually transform the way we live. It's practical, it's goal oriented, and it teaches us how to respond with clarity, resilience, and compassion in our daily lives. And that's why this conversation today is super important, because no matter who we are, a child, an adult, age, any gender, doesn't matter. Mental health touches all of us if you agree it or not. We all face struggles and we all need support. So let's talk openly about one of the most crucial conversations of our time, mental health. And please join me in welcoming Dr. Deepti Talluri. We want to know you, Deepti, first.
Yes.
Many people call her Dr. Talluri, but we want to keep it casual, and she's become a good friend of mine, so I'll keep it to Deepti today.
Yes. Yeah, please.
Thank you.
I would be happy if you called me Deepti.
Thank good. I asked you, you said go with the flow. So
Just go with the
it
flow,
felt
yes.
with heart, So
Yes.
that's what. So Deepti, we want to know you.
Okay.
So I know a little bit about you, and just tell our audience a little. We know doctor part, but we want to know the little girl who grew up, her childhood, her passion. How did she get here? So you're from Vijayawada,
Yes,
Andhra
I'm from
Pradesh.
Vijayawada.
So tell us a little bit about your family. I heard your dad is a lawyer, mom
Yeah.
is a housewife. Tell us how your childhood was, and what got you into the medical field, and how life was there.
Okay, so basically, I consider myself as a human being, first of all, foremost, So my childhood was pretty simple, just like any other. I was mid-80 born, so I know we are grown up without internet, without much social media and all, right? So totally we are in a different environment. The family relationship, everything is totally different. There used to be power outages and all.
Yes.
We used to play outside. So completely different lifestyle compared to now the current generation kids. So I personally feel I thoroughly enjoyed all my childhood milestones. And like any other person who says, I have the most beautiful mom and dad. So even I want to say, because for every person, their mom and dad are the best, right? Compared to my mom, I think my dad kind of, he played the most influential role in all throughout my journey. And he is no more now. He passed away like 3 years back. But still, I feel he is with me in every bit of my life, still influencing, right from my kindergarten. Even I personally say that even if he is physically not there, but he is emotionally
you.
with me in
Yes.
every moment, and
I
all.
think I know that.
So my childhood is so simple, just studies. He's so strict that I want to listen to his particular things and all.
So it's incredible that you
Mm.
worked so hard,
Mm.
got your MBBS,
Yeah,
became the
yeah.
doctor. So did you practice in India?
No, I mean, like 1 year internship I
Once,
did,
okay.
and I immediately got married.
Got married.
Yeah.
But
Came
you
here.
knew coming here you'd have to restart, no? Because I
Yeah.
think the certifications in India.
Oh yeah,
don't
I knew that. I knew
eligible.
that. But for me, right from beginning, mental health is like my priority, because even from my teenage years, I have the habit of like inner voice. I'm so young, maybe 10 or 11 years at the time, but still I have that intuitive feelings, like the gut feeling. I used to have strong gut feelings, and I'm so compassionate towards the people's emotions,
Giving
and
back and helping, you mentioned.
yeah, the suffering and all. I used to feel so bad and so sorry for the people who are really suffering. And what I realized is, when I'm growing up, I seen some persons even within my close family and all, who really suffered with some kind of depressions and anxiety and all. What I realized is, compared to physical health, mental health is extremely
Yes.
traumatizing, or that's how, even during my early medical school days and teenage years itself, I got that passion towards mental health and all. And I think I'm so extremely analytical. Whatever happens in my life scenario situations, I try to analyze that, why this happened. So I checked for the options and all. Then I did my healthcare administration program. But still I thought, no, I have to do, something specialized in the mental health counseling and all.
You were definite about that.
Yeah, as I said, I'm so clear. So even I pursued my healthcare administration, but still my mind, my inner voice is saying, no, this is not your cup of tea. You have to do something in your, mental health, your passion. You have to pursue your passion. So again, I started my studies again in cognitive behavioral.
Wow. So many times.
Yes,
you
so many
started,
times I studied.
restarted.
See, until like before 3-4 years before, I'm still studying, like almost like
Hats off to
35
you.
years I studied for 35, 36 years, So finally,
Hats
I'm a certified, cognitive behavioral therapist and all.
Wow.
And
wonderful.
that's how someone could pursue something with whom they are passionate about. They don't get any sort of mental health issues,
Yeah, there's no stress because
Yeah.
it doesn't feel like
Yes.
work, right?
Work.
You're enjoying
Work. Ultimately, we have to enjoy the work, that 9 to 5 job. But during my day to day dealing with the patients or whatever, I see 70% of the people, they end up or land up in professions whom they are really not that passionate about, because money is important, right?
See, I
to
think
survive.
that's what I want to talk about.
Yes.
Money is definitely
Money
important.
is important.
But also knowing the passion.
Yes.
Not everybody, or I should not say, know what is passion.
Yes.
Sometimes you're struggling to identify what is exactly I want to do. That clarity, to comprehend it, to process it also. I think today you want to touch that topic, how to identify
that is like
passion.
that is like a kind of, because as I said, we are like mid-80 born kids and all. During that time, we are so much conditioned towards our parents' ideas and ideologies, right? So the parents are like the kind of deciding factors what to study
To
and
listen.
not. Yeah, during
to
my
listen.
childhood, my dad and all my family, they all say that, if you're a girl, you have to become a doctor. If you're a boy, you have to become an engineer. Even I have a brother and he is an engineer.
And today, endless options. I think kids have too many choices now.
See, now the generation have changed, right? Because they are voicing out what they want.
Yes.
So it's a good thing. In a way, we all think the social media, everything is like kind of influencing them in a bad way and all. But
it has pros and cons.
Yeah, just like every coin have two sides. Pros and cons, how you use the social media and all. During our therapy sessions and all, when we deal with 50-year-old or 60-year-old people, even still they are sometimes in a confused state. They don't know what they want actually. That's what hindering their emotional suppressions and blockages and all. That's how the mental health problems will develop, But you know what? Even when I'm raising my child and all, even if I'm not actively pursuing my USMLE or residency or whatever, but I'm in that medical field, a volunteering work and all. So every week, once or twice, I used to go to the clinics did my internship research. I'm active. I'm not just sitting at home doing something or other, whatever, but in the medical field.
Listening to you,
Mm-hmm.
the adjectives are just, I don't know why, the adjectives are just coming to my mind. Calm, composed, clarity. I think
Yes.
that the note you hit.
C cube.
C cube, yes. And I think clarity in our generation versus in kids now, you had clarity. Not at that generation,
See,
that was not a
I
very high
don't
note.
say our generation doesn't have clarity. We have clarity, but we have the conditioning, right? The parental influences and
Yeah.
pressures.
That one I totally
So because of
admire.
that, we might not be, we might have lost our capacity or ability to clearly express our. But now parents are flexible to listening to this. I'm so clear, what to buy and all, what to wear. I'm so clear. I just don't go and see with the trend or whatever and all. I know what I want, and I'm so clear in that. So even if I go shopping and all, we don't go as a group or with friends. I never been to shopping with any of a friend. Me and my mom used to shop or alone. I love shopping alone.
Wow.
I just pick myself whatever I want because I know and I'm clear that okay, this makes me comfortable. I'm happy in this, and so
you don't need validation.
No,
you don't need. Usually, girls like to go shopping together.
Together,
Not
right?
girls,
Yeah.
Everyone. You
Yeah.
had an opinion. You wearing something.
Right.
This is looking nice, but wow, something new I learned about you. I was almost going to say when you
that
said
is what if we always seek for the valid. If not seeking validation means it's not like disrespecting the people around us, parents
Just
or a
taking
husband or
another
a
opinion.
spouse. If you know what you want, if you're clear about what you want, you don't mind, other people's opinion and all, right? So clarity దగ్గర పెట్టండి. So see, I told you that I'm clear what I want, right? It doesn't mean that I'm 100% I have clarity in all the situations because after all, even I'm a human being, right? I'm unclear about many situations and all. But when I'm exposed to those kind of situations, uncleared situations in my life, I try to sit myself and talk to my inner voice and make myself clear. Understand? It doesn't mean I'm clear in all aspects. Even I am
you're
unclear.
basically able to silence the external noises and listen to yourself.
Exactly. If I'm unclear about any particular situation in my life, I try to mute all my external factors. Just go deeper and deeper. Just listen to my gut and intuition. Like why I'm unclear about this.
Deepti, you talked about behavioral therapy, right?
Yeah.
Where you're listening to the cases, listening to the patients, kids, adults, whoever gender biased, everyone comes to you. But one thing, very common problem that we have seen around is drugs, right? Addiction to drugs or sleep amnesia problem. People are getting used to medication to get to sleep. Does CBT help with those, or what is your take on how can those problems be addressed?
That's a different issue, totally. Mental health is different from addictions, right? Addictions are prone to mental health, actually, indeed.
Okay.
Or mental health, people can take some sort, like a drug or alcohol to cope up with their mental health stress. Most of the social gatherings these days, taking drugs have become a normal cultural norm, right? So even this is a kind of lifestyle change, actually, indeed. What I believe is that. So they think it's a kind of pleasure. Why they are taking drugs and all? Because they want to forget everything, and it's like a kind of pleasure, right? It increases the dopamine in their brain and all. So they feel so good. They feel on high and all. They forget all their problems.
But it's temporary.
But it's a temporary because and also it is addictive. When once our brain gets used to that pleasure point, it always again wanted to do
wants to
again,
keep. That
again,
is why the
again.
addiction.
So that's why the addiction happening. So why this is happening means because of societal lifestyle changes. Drug addictions are also happening in the teenagers, compared to adults, schools, especially in countries like America and all. In high schools, it is a huge
issue.
It's not easy. CBT and all, they don't work. They can assist, but actually they have rehab. They have to go through rehabilitation programs.
It's a very challenging problem.
It's challenging,
in this generation.
especially.
I think it's just a self-awareness.
Self-awareness, and we have a lot of self-awareness programs and rehabilitation centers as well, especially in this Forsyth County as well.
See, I feel they went through struggles, they're going through struggles, they have challenges, and it went to a saturation point where they started taking drugs. So I think also understanding at what point, if early in the game, in the situation, if early in the situation you realize that there are issues, and seeking help at the right time, hoping things don't go to that level. But I think that is another point I want to tell people is seek. Don't go through that stigma of mental health that, oh, should I go? Oh, no, we are fine. I think we can handle. But if you feel you're facing a struggle and day to day you're unhappy or your kid is unhappy, going through challenges, go seek the therapy, seek help early on.
Yeah.
Hopefully it doesn't, go to that dire
always
state.
early treatment always works,
Always
right?
better, yes.
It is always easy to pull a plant compared to a tree, right? Because the roots are tender.
That's a good example.
Yeah.
But in our Express with Sirisha on our show, you and me are sitting here. We are doing the best we can for our audience to learn. Atlanta people know you, they can approach you, come to you for this help. When we talk about mental health, I know self-awareness is the key.
Yeah.
Obviously, as you said, you and me are talking versus when Deepika Padukone talked about her issues, lights are higher. People are paying more attention. When there's a known face, famous face, people listen.
Yeah.
Obviously, we are trying to do the best we can sitting here. Awareness, getting the help at the right time, knowing where to go, when to need help. Sometimes the parents don't know that the kid is going through the problem. You find out way later and sometimes it's very late. Versus the other way, when you are in trouble, you don't know when to seek help. Families are collapsing with issues of dealing with family members, going through from ADHD to drug addiction to all different kind of problems. What would you like to share with our audience on how to cope with those?
Foremost, I think the problem should be addressed at the root level. So how a family can cope up means, what I believe is the family structure should be good, right? Most important, for example, if mother and a father have to raise a mentally healthy child, first and foremost, the parental relationship should be great, right? The relationships are like kind of isolated because the parents don't find much time to spend time to the kids. The parents these days don't find the fruitful or the valuable time to spend with their kids. And most importantly, there are a lot of parental conflicts are also going on, the husband and wife couple conflicts and all. These are indirectly impacting the kids a lot. And kids, they feel the parents are not the safe place or the safe environment to approach. So they are going to their friends or going to some third persons and all.
Family bonding,
so, yes,
spending
exactly.
more time, visibility.
Yeah. For anyone to raise a mentally healthy child, first of all, the family bonding should be good. Foundation should be great and communication is the key no matter what. Parents should definitely find at least 15 to 20 minutes per day to talk to their kids. Even most of the parents, when they're spending some time to their kids, they're on the phone or watching some TV or whatever, right? And the parents itself, they know, right? When they're talking, they know that their kid is not doing well. There is something happening. That's how, right? Through communication only they get to know.
So I think family, foundationally, right? If the foundation is strong, obviously, the tree is also rock solid. So increasing that communication will give that visibility.
Yes.
Now, are there any key points? What would you suggest the parents to look for? What are the triggers that say, okay, now is when I think I need help? I need help, or my kid or anybody in the family.
Yes.
If I know you had some trigger points that you wanted to share with us.
Yes. So it's just a basic observation, So when you see your kid, you always see certain patterns, right, day to day. But when you see the regular patterns are changing, for example, if he's sleeping every day at particular point of time, and if sleeping habits have changed, nowadays he's taking forever to go to sleep. Or if he's not eating the food at the right time. So if his day-to-day activities, if you notice any changes in day-to-day activities, then that is the first trigger point. Okay. Then the other point to know that our child or whoever is not doing well is whatever the situations that have given him happiness, given him or her the real happiness. And now the same scenarios or situations, they're not making them happy anymore. Understand? That is also the greatest trigger point. So change in day-to-day routines, lack of sleep, or more sleep, or lack of eating or more eating, because emotions and food habits are interlinked.
Yes, intuition and gut health.
Yes, brain and
Yeah.
our stomach, they both are interlinked. We call it as emotional eating, right? When we are depressed, some people eat a lot. Some people eat very less. So when someone is depressed, they put on weight. When someone is depressed, they decrease their weight. So our emotions will
There's a
affect
direct
our physical,
connection.
yes. Our mental health will affect our physical health. So always look for the physical signs first. So mental health problems, they don't come up in a single day at a single moment,
overnight,
not over. They show so many subtle signs, that starts with the body itself.
So I think this applies not only to parents and kids, right? Even to yourself.
Yeah, ourselves.
Observe your own patterns. Yeah.
See, that's why being in the present moment is very important. If we are in the present moment, we can observe what is going on within our body, right?
That is why if you're watching and eating,
Yeah.
you're not even focused. Are you
Focusing.
overeating? Are you not eating?
Yeah. We are watching TV and we are eating, so
You're not present.
we don't know how much we are eating and all. So it is important. Observation is the key for any sort of, because even heart attack, stroke, or whatever, they don't come at a single second or point. Their body gives some twinklings, we call inklings, some signs. So if you are aware and if you are conscious, if you are able to focus on ourselves, then we can know.
We can notice those.
We
We
can
have
notice,
to observe.
yes.
So I think change starts there, right?
Change starts physically,
Self-awareness,
yes.
noticing the patterns, being present,
Yeah.
seeing your changes, noticing your changes.
Physical symptoms,
Physical symptoms.
loss of hair or skin changes or dull face or whatever,
So the
Everything.
first step is knowing when to seek help.
Yes.
Then the second is accepting that I need help, and
Yeah.
then reaching out for help
Yes.
to physicians like you. And then it only can increase. But I think the early signs, if we catch at this phase, to your point,
Yes.
hopefully we can help families not get to
Yeah.
addiction, that kind of. So when patients come to you, and sit in, do you start reading them, observing them
Yeah, of course.
behaviorally, and what are the first few things that you notice about them?
Of course, the body language, the physical gestures, and all. As I said, right from my teenage, or not, right from my early childhood, I'm so strong in the gut feeling, right? Intuitive gut feeling. I don't know, somehow I can feel and sense the energy, that vibration and all. I think I can sense it. No matter what, their eyes, maybe, through eyes we can know everything,
Close my eyes now. So I'm secretly in my head, I'm thinking, let's talk about
Each
the
of our
present
emotion
situation.
is carried through our
What are you
eye.
processing? What energy? When you see me, how is your analyzing going? What are you thinking in your mind? Are you kind of secretly analyzing me right now?
Oh, no. Always. We do the 24/7, right?
Okay, we are raw and real, so please. I'm scared to ask, but no,
Yeah.
I'm curious.
Curious.
I'm curious to ask.
Yeah.
What do you observe?
See, at the physical level, I can see you're energetic, you are well spoken, communicative, smiley, and all right. This is all the physical aspects. I think emotionally, you wanted to do something, you want to give it back. I believe you like talking with people, first of all,
Yes.
because the way you communicate itself says that you are so excited. When you talk to the people, I can really see you pay attention. Understand? The serious mode.
I am present.
You're present. Exactly. That's your meditative phase actually when you're talking with the people,
Wow.
Means why you are in that stage means you're interested, you're passionate about learning them. So that's why you might have doing these talk shows and all. So inside at the core, what I feel is you like communication with the people and you like to take things from their experiences as well. And I believe you always look for constant improvement. You're not stagnant, right?
Yes.
You always
very
keep
true.
on day to day. You like to change. You
Want
like to
make
learn.
my life better every day.
You
with
always
the best version
every
of
day to day
myself.
better. That's what I can see emotionally, through your vibe and all.
I think she's on camera, so she's saying all good things about me.
Oh no.
But I loved it. That is
I
so
could-
well. I think I deeply associate. There are a lot of thoughts going on in my head.
Yeah.
Actually, I have to process these. And I think when you said CBT is all about thoughts and feelings and actions, I think to each line I can tangibly relate that to one of the core reason of why I started this talk show. So I cannot be thankful enough. I know we are not concluding, but I'm fascinated, mysteriously fascinated by how you do that. I don't think we talked at that level, right? We only talked very few times.
Very few times.
But
Here I want to say not just CBT, that simple talk therapy, not only the professional talk, just two friends or two neighbors or whatever. The talk, that communication itself is like a kind of healing, right?
Yes.
So I don't want to just put CBT. The talk, the real talk is different from just the talk.
I
You
agree.
understand, right?
When I meet my friends, I
it's
feel
kind
so
of
good.
therapy. Communication is always the key. You need to have the right person next to you who can listen, and that itself is healing.
All the people who are watching and my friends know that I'm talking to them. I am blessed with the kind of friends I've found coming in Georgia. And my husband actually tells me when I'm down and sick, he's like, first day went, second day went, and he'll be like, just call your friends over. You will talk to them 2 hours, suddenly you will not be sick, everything will just get up. But that is actually so
Friends
true.
are
It's
all
therapy for me.
counselors, that's
The best,
everything.
best time I have with them. And take your time, have your girls' time, have your me time, have your bonding time with kids, do that one-on-one. To your point, I think now that I'm connecting the dots, it's being present in that bond, in that relationship, giving 100%,
Paying attention to what they...
I have 2 kids, but I try to have one focused one-on-one with my son sometimes because he needs my attention versus my daughter sometimes, because together I love them both, but they both need my individual attention at some point. So I think being present.
And this is the first step to address any mental health issue. Just talk with your close friends or family. That itself is healing. If still you're not able to heal, then you should seek external support. See, in all the talk, there is like 2 kind of vibrations: higher vibratory words and the lower vibratory words. If you are always in that higher vibration mode, like non-judgmental, no jealousy, no hatredness, no competition, no anger, nothing. Only, compassion, love, kindness, everything. These are all the higher vibratory modes. If we are in that phase, it will keep your mind in a higher vibratory phase, and you have zero chance to get all the...
And life will be so much better.
Life will be so peaceful and happy.
And let be happy.
Yeah.
So Deepti, on Express with Sirisha, we like to keep it raw and real. So help us, share with us some of the most common struggles. You see so many patients in the mental health awareness field. What are the most common struggles that you have seen in the category of women, couples and teens, as we had talked about? And how do you suggest to our audience how to deal with them, or therapeutically from a CBT perspective? Any guidelines or solutions you can provide today would be great.
Yeah. First of all, mental health itself is like a kind of stigma in our society. Understand that, especially in a country like India, and especially we growing up in India and conditioned with a lot of traditions, values and all, because we used to have a lot of support system, right? In our younger generation, we used to have all the elderly people. So during that time, if someone says that this particular person is having mental health issue, our family used to disregard it. Come on, we are all there to support you, right? You don't need any additional support in the healthcare setting or whatever. We'll help you. So the family used to come forward and help that particular person. If, for example, if that particular person is depressed or whatever, they used to come forward and help them. But nowadays, that itself is becoming a challenge, understand? Because of the nuclear families, and people are isolated from the family system, also from the nature, Before, we are so much connected with the nature and all. So now we are completely disconnected. We are always in the closed environment, 24/7, either air conditioners or heating systems or whatever. ADHD is lot of ADHDs for kids, anxieties, depression, OCD, schizophrenia, hallucinations, illusions, Alzheimer's, dementias, Before, all these are like diagnoses for the rare diagnosis. These are all, even when I'm studying, during my medical school, we used to have only few patients, not too many. But now, every day in all the settings, the patient count is increased. Lifestyle, food habits, relationships, and our thought processes and social media influences and all, especially a lot social media. Because nowadays, we are always comparing ourselves to some other person. So this is all based on my experiences and my research, because I do a lot of research in this field, as I told you. So whatever I'm saying, it's all my perspective, not like a kind of this is exactly, because always it is varied. Every situation is different and
Case by
everything
case,
is just my perspective. I don't want to. Next is, instead of we seeking our own validation, we are relying on other people validations. Other people in the sense, I don't want to say people, maybe social media. Social media have become a huge validation point for everyone, including the kids, right? So isolation, validation, comparisons. We are not happy with whom we are, what we are. We are always trying to compare ourselves with something which we don't have, right? But the best advice for any sort of mental health issue is, if we land into some sort of problem, what we have to do? We have to compare ourselves with set of people or set of situations where the problem is much lower, but we always end up comparing our problem with other people higher, right? This is the quotient ratio, very much important. Like, for example, most of us are not happy with how much we are paid. Okay, understand? We always try to compare our pay rate with people who have higher pay rate than us. We never ever compare our pay rate to people who are lower. We are doing so much better compared to them, right?
Everyone says stress. Acne issues, health issues, this issues. How do you identify stress? And I know everybody says reduce stress. How do you do that?
Yes.
I think that's a very common question, at least I have. I'm not.
Yes.
But
So first of all, everybody's stress is different, right? How they perceive stress is
Yes.
also different. First, we have to consider how they are perceiving their stress, because
Case by case,
for one person, they might consider as a stressful situation, but for some other person, the situation might be not at all stressful. Understand? So how they perceive the situation, stress is very important. So people should understand how they are perceiving. Is this really a stressful situation? Because that's why, listening to our inner voice is very important. Talking to a therapist and all, it will help you, but you have to listen to yourself. Is this really a stressful situation that I have to stress out? But most of the patients, they say, it's out of my hands. I'm trying my best not to be stressful, but I'm completely out of my hand. See, if you're completely out of our hand, means our body and mind is not aligned, right? First, make sure your body and mind is aligned. Now, the next question comes, they'll ask, then how can we align our mind and body?
yeah,
Are we eating really healthy food?
healthy food.
Check it. Now the lifestyle completely changed, right? Relying on all the, ready-made
Ready-to-made.
food, or, frozen
Easy.
chapatis or rotis or whatever, everything. So before, our moms used to make all the fresh food. Fresh food is always nutritious, right? Nowadays we are cooking during the weekends and we are feeding all the food Monday, Tuesday, Wednesday, Thursdays and all. So all the nutrition is gone. First, we have to take proper nutrition. Make sure it is balanced, fresh. We are prioritizing ourselves for the 9 to 5 job. In the same way, we should prioritize ourselves for at least 30 minutes or 40 minutes cooking per day, no matter what. Because it is our body, it's our responsibility, right? What will we do just with the money?
Very well.
We can't buy health. See what? If you open a social media, right immediately after we wake up, we are influenced, right? If we see someone going to vacation posting happy pictures, we'll be feeling, oh, come on, we are not. Or if some happy couple posing some happy picture, oh, we are not like that. Always we are comparing and, we are influenced. Our day is ruined. So the body is ruined, the mind is ruined. Understand? So for the body, the nutrition, day to day, our morning routine, afternoon routine, evening routine, our day to day routine, our movement, exercise, everything matters. And same for the mind, we have to do exercises, because constantly 24/7, only during sleep, we don't think, correct? But the moment we are awake, our mind always thinks something or other, consciously,
Non-stop.
subconsciously, whatever. Just sit down, relax, shut down everything, all the external sources. Relaxing in the sense is just being aware of what is happening in our body, just observing our body. That is what we never does that. But if we are able to sit for some time and able to observe how we breathe and all, that matters a lot. That instantly calms our mind.
That is
Yeah.
the whole meditation,
All
breathing
meditation,
practices.
breathing practices. If you're cooking, if you're just focusing only on the cooking, we are at a meditative stage. That is what I believe.
So basically, don't let your mind wander.
Yeah, because
think
our
about
mind
too many
constantly
things.
thinks on too many things. If we are able to cut down many things and focus only on whatever we are doing at that particular point of time,
present.
be present is what the best exercise we can give for the mind.
Tomorrow morning, I will not look at my phone for the first 30 minutes at least.
Yes.
That is
Yes,
the
that
decision I
morning
take.
routine is very important
I
because
really like the example you gave.
the entire day depends upon the first few moments after we wake up, because if we are happy and if we are calm, composed, our entire day will be like that. But immediately if we open our phone or if we see a message or if we check some other's achievement or whatever, even if we believe that we are not triggered, but subconsciously our mind is triggered. Oh, I missed that. I should have done that. I should have achieved that. Even physically or, consciously, if we don't accept that, but subconsciously we regret that or we miss that or whatever.
Yeah. What about kids?
Mm-hmm.
We are all parents now in this generation that we are living today. We are all Indian parents, came here. Most of the kids either born here or raised here with, the mentality of a very Americanized mentality. What are the most common struggles or challenges you have heard from that generation, and any solutions or suggestions you have to share with us?
American kids are different and American kids born to Indian parents are different.
Yes.
And I call it as a crushing syndrome. The way they grow up is completely different than the Americans. Because Americans are purely Americans. But here, these kids are overlapped between two cultures. There is no hardcore principle like this is how we can raise a kid, this is how we can do. No, because the best part is the kids, we should let the kids grow. Understand? We should let them grow. But as a parent, we have to provide a safe, secure, healthy environment. That should be the main priority for all the parents. But we shouldn't condition what we believe or what we think or what we have conditioned everything on.
Don't impose our
Don't
learning.
impose. Yeah, we shouldn't never ever impose our learnings to our kids. Only when we touch the fire, we know that it is hot and burn, right? Until then, the kid doesn't know that it will burn. So when the kid just put his hand on the fire, he will never ever does it in a lifetime. But how many times we say don't put it, but he have the curiosity, oh, I have to put it. But until the same way, kids have to learn, they have to fall, they have to break, they have to go through everything. It shouldn't be always comforts and luxuries and all. They have to go through all the hardships. If you want your kid to be mentally healthy, fit and all, they have to face some struggles and you should be wide-hearted to let them face it and leave them. But I see many parents, if they suffer a lot, they can't tolerate that. They immediately wanted the quick results and all. So quick results always never work.
Instant gratification. That is a problem in this.
Yes, instant gratifications never work. Even the parents should be broad-minded and prepared that their kids should fall, struggle, everything should happen.
True. So I know, raising mentally healthy kids, we all parents want to do. How about teenage? Do you have a lot of teenage kids coming to you?
Yes.
What kind of problems do they come to you for? And how does CBT help them? How do you address those issues?
Teenage brain is like a kind of extremely vulnerable brain because the teenage year, the transitions from the childhood to the adulthood. It comes between childhood and adulthood, right? Teenage from 13. So from 13 year on, the teenage brain develops a lot, like the prefrontal cortex, it develops so widely. Every day it develops, it grows, it prepares this child to become an adult. So that happens for 13, 14, 15, 16, 17, 18, all the years, 19. I think until 21, not I think, yes. Until 21 years, the brain is not fully formed.
Wow.
Only after 21, 22 years, they're considered as an adult. Even 18, 19 is not considered as an adult. Maybe physically they might be adult
I know why
and develop.
21 is a number.
Physically they might look like an adult, but still their prefrontal cortex is the area of the brain for planning, execution, judgments, and all. See, whatever decisions an 18-year or a 16-year-old makes might not be the best decision they can ever make it, because still their prefrontal cortex is not properly formed, right? Your child needs you only until they reach 21 years. When once they reach the 21 years, just leave them. Don't again still superimpose them and condition them, do this, that, or not. But until 21, see your child as a growing, vulnerable, extremely going through a lot of hormonal surges and all. Be in that mindset. And most of the parents whom I work with, as a teenage therapy, parents and all, they always ask me question, we are doing a lot to our kid, we are providing them everything, but why they are like that, but why they are not listening, why they are not respecting us? Because what's happening in their brain is completely out of their hands, out of their body. Lot of chemical hormonal fluctuations are happening in the teenage.
So when
They
come to-
can't control. That's why so many have the anger issues. If they had a fight in the home, they suddenly pick whatever it is next to them and throw it, right? Because they become impulsive.
So
They
how
know
does
it is wrong.
CBT help them? Like, do you talk to them case by case? Or?
See, CBT is like a cognitive behavioral therapy, right? So the meaning of CBT is a kind of psychotherapy, changing the behavioral patterns. For example, if the kid or a child have an anger issues, so we want to do CBT on them, cognitive behavioral therapy. Here the behavioral problem is anger, having an anger. Anger is an emotion.
Okay.
And it causes some sort of behavior. Like what type of behavior? Picking whatever he finds in a fight and throwing it away, or getting impulsive, or use some bad words. These are all like the kind of behavioral patterns. But here the root cause for all these behavioral changes is the anger. Yes. We'll
What is
try to
triggering
find
the
what is
anger?
triggering, what is exactly triggering them all these behaviors.
So you talk to them, you find out the root cause, and you work them through case by case.
Case by case. And we'll do the cognitive changes. If we work on the root cause, obviously the cognition, how the brain perceive, react, response will change, right? But for every mental health problem, obviously there will be a solution, right? If our brain have that chemical imbalances, for example, if some person is diagnosed with depression, if they have chemical imbalance in there, means like serotonin, all the dopamine imbalances are there, then definitely the problem can be solved only through medications.
Got it.
Understand? But if that person doesn't have any sort of chemical imbalances, we can actually work with CBT, behavioral therapies or talk therapies, or with sessions and all. But unnecessarily nowadays, I believe unnecessarily everyone is prescribed without any reason. Most of 60% of the kids are prescribed ADHD medications without any reason. Because most of the kids, parents, the attention span is like most common issue these days, right? For everyone, even for the adults nowadays, everyone are getting attention spans. And can I say you the reason? Because we are so used to that Instagram reels and all, right? We are limiting our brain to 30 seconds Instagram reel concept.
Yeah,
So
very
most
short
of the
span of
adults,
focus.
even the kids, why they get attention deficit, ADHDs are many factors. First of all, food habit. I told you, when the brain is in the developmental stage, it needs a lot of protein. Do you think all the kids are getting enough? Not even the kids, adults or whatever.
Adults
Are we
also.
getting enough protein? Some kids are more hyperactive kids. Means they need to vent out the energy. They have to play some soccer or tennis or whatever, which burns all their calories and energy. But all those kids are ended up sitting in a room drawing or painting or whatever. So those all that energy is again accumulated in their body and all, and how come
That's
the kid
causing
be
issues
that's
then.
causing issue then. There are so many simple lifestyle modifications, food habit changes. The first itself, in the starting point I told you, right? Nutrition, lifestyle, everything. So all these are interconnected actually.
Wow, Deepti, that's a great insight. Thank you so much. I mean, just listening to this has brought me, like, I have so many conclusions and takeaways that I'm already thinking. Definitely, I think lots, but the one that resonated the most with me, and I'm going to implement it first thing starting tomorrow, is not looking at my phone for the first 30 minutes in the morning when I make up.
Even for all the audience, morning routine is extremely important.
Yes, I will do
Extremely.
that. Thank you. So, Deepti, we have a tradition on our show.
Oh, yeah.
With every guest that comes, we talk about their journey. We talked about the profession they are in, and we always do one section called Jhatke mein response. So
Jhatke? I'm poor in Hindi. Please explain me.
It's nothing but a rabbit.
Jhatke.
Jhatke.
Jhatke. Okay.
Yeah, so immediately.
Immediately.
So I'll
Oh,
give you
okay.
a question, and the first thing that comes to your mind, you have to answer.
Oh.
So not taking much time to think, and I think you are very good at it. How you within 2 minutes or 2 seconds actually? How you within 2 seconds gave the answer to your
Yeah, let's
patients?
see.
So I'm sure you'll kill this. But this is just to us to get you know more as Deepti.
Okay.
Okay. How do you start your day? Morning shots, fresh juices, or something else?
Like a breakfast. I'm not a tea or coffee kind of person, but I don't take them with an empty stomach. After the breakfast, I'll take it.
Okay. I know you're not a coffee and tea. That is why I made nimbu pani for you today. Okay.
But
Early
I like tea and coffee.
Okay. Early mornings or late nights? What is the productivity sweet spot?
Late nights.
Late nights.
I'm
We can
active.
see.
I'm active after 11 o'clock. 11,
really?
12 is like my, yeah.
Oh my God. I don't want to disclose the time right now. Are you introvert or an extrovert? How would you define yourself, or somewhere in between?
Depends on the situation, I can transition. If I want to be introvert in some situation, it is possible, but I try to be extrovert.
Okay, good to know. Most irrational fear that you secretly have?
Snakes. Oh my goodness. Snakes and water. Snakes and water. I always get the dream I drowning in the water, I don't know why. Right from a childhood, I get the kind of dream that in the big ocean, I'm drowning like anything. I don't know why.
Really?
I don't know why. It's crazy. I try to decode why I get the dream and all. I don't know. I have no answer. But me, myself, drowning in water is my biggest irrational fear. And seeing any crawling snakes.
Okay, I'm not doing beach vacations with you.
But
I didn't put this question knowing that actually.
But I did rafting and all.
So you can swim?
I learned swimming, but I can't swim now. When I'm like, because I'm phobic to water, my dad made me to learn swimming.
Okay.
But I can't swim.
So you got over it. One habit that you think everyone should try for mental peace? I know we talked about a lot, but one thing if you have to pick.
Be in a present moment.
Being present wherever you are 100%.
Be in a present moment and always think about the highest vibrational thoughts.
Texting or calling, which one stresses you more?
Nothing. I'm actually very quick in responding to calls or texts all the time, 24/7.
Wow.
Yes.
Awesome.
I like both of them.
Meditation, music, or Netflix to recharge?
It depends. Sometimes music. I think I'll go with the music.
Music. Okay. Very meditative. A word you use too often in therapy sessions?
Right? Understand?
The phrase?
The phrase, yes. Right.
You know, right? Okay, we're going to remember that. You know, right?
You get it or understand? I don't know. I think, but people should say, I don't know.
Well, sometimes you catch yourself
I
saying,
catch yourself. Because I heard so many people saying me right. I use the word right a lot. I don't know.
Okay. I'm scared of asking this one, but I think we covered this one. First thing you notice about a person when you meet them?
First thing I notice in a person.
First thing.
Intentions, maybe. Yeah, it's easy. Intention.
By looking at them?
Yeah.
How?
Yes. Eyes, right? Eyes speaks actually. Subconscious, we can. Intentions in the sense, are they scared, or they angry, or they in a frustrated mode?
So you
That
see
is
their
what I
eyes
meant.
and you can understand.
Maybe their emotional status. Actually, instead of saying intentions, I can say, I can immediately sense the emotional state of a person just by looking.
At eyes. Wow. I should make 10 types of eyes right now, different expressions, and see how that goes. Your secret guilty pleasure. Don't hold back. You have to answer whatever comes to your mind.
Guilty pleasure?
Shopping.
Yes. Maybe. Guilty, I never feel guilty for shopping. I'm happy to shop actually. So I don't think shopping is my guilty pleasure. See, if I
Just
do
your pleasure.
see, I do only things which I'm not guilty about, most of
Very
the time.
well said.
If I feel guilty, I don't do that.
Wrong question to the wrong person. Okay. But
No, this one
love the
I
answer.
learned through my age and experience. Before I might have done a lot of guilty things, but now I can't do
I'm
anymore.
changing the next question on the fly. It's actually guilty pleasure snack, but I'm going to just ask her, what is your favorite snack?
My snack? Oh, my snack.
Favorite go-to?
I like something spicy. I like punugulu.
Oh, okay. Those are small
Not
Indian
spicy,
fried,
but
South Indian fried.
I don't say no. Just disregard that. But whatever it is, if it is spicy, tangy, and like kind of. Wait a minute. I'm not a foodie person, honestly. This is the wrong question you asked me.
I can see that. I can so see that.
I'm not at all. But I love chicken biryani, no matter what.
Okay.
I enjoy
Okay,
that. That is the only food I can enjoy in this world,
Chicken biryani?
Chicken biryani.
Wonderful. Okay. Okay, one small daily ritual that you do for yourself that others might find helpful and works wonders. Any suggestions from your end?
Every day I try to go to open space, just open my door, go outside and just breathe fresh air, look at the sky. Like a nature, maybe spending
more time
most time with the nature. That everyone should do.
Okay. I think that was all the questions we had. I know we can keep asking you a lot. It is very fun with you asking more questions and getting to know you, because we see you in that zone of a doctor, and then we want to, get to know you more.
Yeah, even this is funny, to answer these questions.
It makes you think, and we
Makes
don't
me
share
think,
these
I know.
questions before, right? So people have to know these. That is why the time. I know we said rapid fire, you want to answer quickly, but I do realize sometimes it takes a minute to think and process.
In sessions, we answer to other questions, right? But now answering to these questions is like kind of fun to me. I love it.
Not therapy, but you are in the hot seat.
I like that.
Yes.
I like this.
I hope all things we covered, our audience listens, takes actions, inhibits, adds those inspiring, values that we shared today, they get inspired by it and use it in their daily life as a practice.
Yeah.
I really hope that we are able to make a change somewhere. That is all what we are trying to do on this talk show. So as part of concluding our episode today, I want to share one point that you mentioned that, I think we touched upon it a lot of times, but I think in simple words, purpose of life. You always kept saying, right, find your passion, find your validation, know what you want, be present. Everything I think comes back to that, that ground point. And I think we didn't really go over how. And I think with you, who has the answers of how, I always want to say, because everybody, even if you know that what to do, knowing how to do, or simple actions you can take towards it. So if you could educate us how to identify purpose of life, or how do I find the contentment, or even know what contentment is and how to get there?
So this is actually a difficult question to many, because finding a life purpose is not that easy. But it is the easiest thing. My passion is to help someone who is really in need. Because now, as in through my medical profession, many people will approach me for some sort of medical help. And I realized my profession is my passion and my passion is my purpose. Because our purpose always parallels with the purpose. Passion and purpose are always parallel. They move parallelly.
I like that line. Passion and purpose.
Passion and purpose. Because what you're passionate about is what you can do 24/7.
Yes.
Right? Without
it
any.
doesn't take energy away. It gives me more energy.
That's the purpose of your life. That's what your purpose of your life.
You just need to find the pattern.
Your pattern.
What is giving you the joy.
What is pattern? You observe the patterns, what is giving you. And patterns also teach us a lot. For example, if we observe our life, for example, some people, they always try to invest in some things and they always end up financial losses. For some people, they always have the bad relationships, all the breakups or whatever. For some people, they all have the losses, family, person loss or whatever. So if we observe our life, whatever patterns that are repeating in our life is where we wanted to focus and learn something. If we try to learn something, we can actually break the pattern.
Wow, Deepti, that is
that's how we can
say it so well in simple words that we understand, and it deeply resonates with me, because I like how you were also like, when you looked at me and I said, are you analyzing me? I asked it on a lighter way, but you answered it so well. And it's so true. I like talking to people. I found my passion. I love dancing also, and I teach dance. That is also a passion of mine.
You like changing.
I like improvising, not changing. I think improvising. I know that there is no one. Everybody can even one dance step I'll choreograph today. I always feel tomorrow I can improvise it to be better. I don't want to stick to the same. I want to grow. I want to explore more things. And I think that is how I started this talk show. I like to talk to people. I love listening to their journey, and I genuinely get to learn so much, and that gives me a very good high.
High dopamine rush. You don't have to take any alcohol.
I don't need any of
sugars
this. I
or
think today's night sleep will be a blissful sleep.
For me, working in the mental health is my dopamine rush. See, that's what, that is your passion, that is my passion. That is our purpose. Our passion is our purpose. And we are doing it, because it is helping you. Because it is helping you keep you high, active, healthy, disciplined and everything, right? Along with yourself, it is helping other people, right? Maybe you started a podcast, you invited me here, I'm talking. Maybe this talk might help someone else, right? So your purpose, your passion, your purpose is helping you and also some other people.
Getting this in front of people, you are doing so much. I want to put you on this hot seat, share your stories, and people learn from this, get inspired, and even if it impacts one life and one effective change, one positive turn, that would just be so happy.
If we just do it as a job or a chore, it's a normal thing, but
just routine.
If you keep your heart and soul, everything into it, then it's a therapy.
Start seeing patterns. I hope you all get the answer for finding purpose of your life. So Deepti, thank you so much for being here today. Your journey, your insights have been truly inspiring, showing us how to recognize when we need help, how to find joy and purpose, how to find purpose, how to find joy and purpose, and help others along the way. To our audience, I hope you all notice your thoughts, express yourself freely, and seek help when needed, and spread kindness. You all walk out of this episode learning something, implement something, and just appreciate, express your feelings. We are not looking for anything more than your likes, and just making sure that this is helpful for the content that we are bringing in front of you today. Mental health isn't a luxury, it's a priority, and small steps that you can change today, make today, turn one page at a time can create big changes. Deepti, I love the words we came up with you on the CQ. Oh. That was amazing. But honestly, you're a true solutions queen, and I like how you have an answer in a very productive, therapeutical way for every problem that we bring to you. And it gives a different perspective of, when we are thinking and analyzing our, I won't say problems, but whatever you're going through, it doesn't have to be a problem. Whatever I'm going through that I'm not able to tackle, or family or friends, and knowing how someone who not only highlights challenges, she's someone who provides the solutions. They're actionable, they're a way forward, and gives you so much valuable insight, on your daily life. These are not theoretical topics. These are pure practical solutions. You can make change starting tomorrow in your life. Get more aware, be more present, and help others around, and find your joy and purpose in life. So let's break the stigma, heal our minds and soul, and make expressing love, seeking support, and finding joy a daily practice. Thank you, and thank you so much from the bottom of my heart, Deepti. Thank you so much for doing this and coming on our show today.
Thank you so much, Sirisha. My pleasure. And I really appreciate you. You told me so many thanks.
That's a small word. I'm trying to express.
No. Thank you so much for inviting me and asking me nice, wonderful questions which are useful. And glad that you find your purpose too,
I'm just thankful.
You're thankful. Yeah, even I'm happy for that. And what else I can say? I'm so happy to be with you, and we had a good talk.
Yes.
Oh yeah, sure. You can. I'm more than welcome. I can talk hours and hours together, right?
I know.
There is no
one hand is not enough for you.